The UK has a mental health crisis. It's costing the country £300 billion every year, which is around $378 billion, almost double the NHS budget. NHS is their public healthcare system. But why is the cost so high? It's because of rising inequality. There's a cost of living crisis. People cannot afford food. They cannot afford heating. According to reports, it's the second most miserable country in the world. And all of this is contributing to a mental health crisis. The NHS wants to tackle it, but it just doesn't have enough money to deal with it. Our next report tells you why the UK cannot afford to ignore this crisis any longer.
Mental health. It is often regarded as a deeply personal issue, but its impact extends far beyond individual suffering. Ask the UK, and they will tell you. Mental health is costing the country over $378 billion every year. It's almost double of the NHS budget. How did they calculate this cost? The report considers three main factors: human costs, economic costs, and healthcare costs. In 2022, human costs were estimated at $164 billion. Economic costs were around $139 billion. A total $75 billion were spent on healthcare. One of the most significant contributors is lost productivity in the workplace. Mental illness can lead to absenteeism. You can miss days at work. There can also be presenteeism. That's where employees are physically present but unable to perform their duties effectively. There's also decreased efficiency and lack of motivation. Untreated mental health conditions can lead to unemployment and disability, further exacerbating the economic burden. But while the economic costs of mental illness extend beyond the healthcare sector, the strain on the NHS and other healthcare providers cannot be overstated. Mental health services face chronic underfunding. There is a shortage of resources. This leads to long wait times for treatment, limited access to specialist care, and inadequate support for individuals in crisis. People are left navigating a fragmented system, one that delays their recovery. According to data, mental health accounts for just 9% of NHS spending, but it makes up 23% of the so-called burden of disease. The report even says that the $378 billion figure may not be accurate. The real cost could be far higher. So what's the reason behind this rising mental health crisis? United Kingdom is dealing with growing inequality. There's a cost of living crisis. People cannot afford food or heating. Plus, there are cuts to early support for mental health. That means more people reach the breaking point before they seek help. According to one report, the UK is the second most miserable country in the world. But behind the statistics lie countless individuals grappling with the debilitating effects of their conditions. So the economic cost of mental health in the UK is not merely a statistical abstraction. It is a stark reminder of the urgent need for action. Addressing this crisis requires a comprehensive approach. The UK must invest in mental health promotion and prioritize the well-being of its citizens. Only then can the country cultivate a healthier and more prosperous society.